Hi, my name is Amy, and I'm a certified child life specialist here at TMC for Children. My job in the hospital is to make sure that you understand what is happening on the day of your surgery and to bring you fun things to do. I work with your doctors and nurses to take care of you while you're at the hospital. It's normal to feel nervous or scared about surgery. Our hope is that talking about what to expect on the day of your surgery will help you feel a little better about your visit. Make sure to ask any questions you think of. You can ask your parents, your doctors, or any staff member at TMC when you arrive. First, you will check in at the registration desk in the surgery waiting area on the second or third floor. A volunteer or staff member will be there to help check you in. They will give you an ID bracelet that you can wear on your wrist or your ankle. This bracelet tells us your name and your birthday, and many people will look at it while you are here for surgery. After you check in, you will wait to be called back to the pre-op area. We have some games for you to play while you wait, but you can also bring your favorite toy or game from home. When it is time, a patient care tech, or P.C.T, will call your name. They will take your temperature, height, and weight and show you to your pre-op room. The pre-op room is where we will get you ready for surgery. Once you are in your room, the P.C.T will also check your blood pressure and pulse oximetry. These help us to know how your body is doing. A blood pressure cuff tells us how strongly your heart is pumping. You'll feel a tight squeeze on your arm, but it will only last for a few seconds. The pulse ox is a soft red light that goes on your finger or toe. This tells us how much oxygen is in your blood. Next, you'll change into hospital pajamas and wait to meet your nurse. The nurse will ask you and your family some questions and make sure you are ready for your surgery. While you are waiting, you will meet a child life specialist, like me. Your child life specialist will talk to you about your surgery and how you are going to get your sleep medicine. If you are under 10, you will most likely use a mask to fall asleep. The mask fits over your nose and mouth, and the doctor attaches the mask to a tube that gives you medicine air to breathe. The medicine air will make you feel very sleepy. You can choose a flavor for your mask. We have bubblegum, strawberry, and watermelon. Which one sounds best to you? If you are over 10, you will most likely use an IV to get your sleep medicine. You can learn more about the IV at the end of this video. Finally, you will have the chance to meet your surgery team. Your surgeon is the doctor who will be doing your surgery. Just like you, they have to wear special clothes when they are in the surgery room, called scrubs. The doctor that gives you the sleep medicine through the mask is called an anesthesiologist. Their job is to make sure you are in a deep sleep so you don't feel anything during your surgery. The doctors will ask you questions, and they may use a stethoscope to listen to your heart and lungs. Finally, you will meet the operating room nurse. This nurse helps you and the doctors so that everything runs smoothly during your surgery. When everyone is ready, your anesthesiologist and operating room nurse will take you for a ride on your bed to the operating room, or the room where you will have your surgery. Your parents are not usually able to go with you to the operating room, but they will wait for you in the waiting area where you came in. They will be able to meet you when your surgery is finished. In the operating room, you will meet more people who are there to take care of you. They will all have on scrubs, just like your doctor, blue hats, and sometimes masks. This helps keep the operating room very clean. When it is time to go to sleep, the mask will be gently placed on your face, and you will breathe like you normally do. You might start to feel a little silly, and that's okay. Your anesthesiologist might even tell you some jokes. You can hold somebody's hand or play a game if you'd like. After your surgery is over, you will be taken to the recovery room, also known as the wake-up room. Our wake-up room is a big room separated by curtains. You might see or hear other patients who are finished with their surgeries too. As you wake up, a nurse will be there to take care of you. Her job is to make sure that you are feeling okay. Your parents will meet you there too. After your surgery, you might feel sleepy or dizzy, or you might feel fine. You may also have a tiny plastic tube taped to your skin called an IV. This tube is small and flexible and goes under your skin and into your vein to give you medicine and water during your surgery. Before you go home, your nurse will gently take it out. Your nurse can usually bring you something to drink and a little snack. If you are staying overnight, you and your parents will be taken to a private hospital room on our pediatric unit at TMC for Children. If you are going home, the nurse will talk to your family about how to take care of you. Your parents can help you get dressed in your regular clothes, and then you will be ready to go. We hope this has helped to prepare you for what to expect on the day of your surgery. If you have any questions, feel free to ask. See you soon!
Can I eat or drink before the surgery?
You will not be able to eat or drink before your surgery. The sleep medicine you get at the hospital puts your body into a special medicine sleep, different than when you sleep at night. This medicine also tells your stomach it's time to sleep. If your stomach is sleeping and there's food or drink in it, you might get sick. You're usually able to have something to eat or drink when your surgery is finished.
Will I wake up during surgery?
Your anesthesiologist's whole job is to make sure you stay asleep and don't feel anything during your surgery. They know exactly how much medicine to give you and will be monitoring you the entire time to make sure you are doing well.
Will it hurt?
Going to sleep will not hurt at all, and you will not feel anything during your surgery because of the sleep medicine. Depending on the type of surgery that you have, you might have some pain or be a little sore after you wake up. It is important that you let us know how you're feeling so that we can help you feel better.
Do I have to get a shot?
If you are under 10, you will probably use a mask to get your sleep medicine. This means no shots that you will feel. We may start an IV while you are asleep. An IV is a tiny plastic straw that gives you medicine through a vein in your hand or your arm. If you are over 10, we will start an IV for you in pre-op, while you are awake and with your family there. The IV is started with a needle. Your pre-op nurse and child life specialist will talk to you about the IV on the day of surgery, including ways to make it easier.